Hello, my name is Keith Bellinger. I'm the instructor of the phlebotomy class in Department of CLS. And today what I'm going to do is just briefly talk to you about the procedure of venipuncture. And it's loosely summarized from the current book that they're using in class during this course. And if you have any questions, please consult that, and it's also on the NACLS guidelines. Okay, now before we begin, we wanted to just first do a quick demo of the tools we'll be using today, or some of them. Gloves, it will be gauze, an adapter, alcohol pads, tubes, the actual needles, and a tourniquet, in addition to the arm. Now, at this point or juncture, we're going to go and start doing the venipuncture. So when you're doing a venipuncture, just remember there are key steps. Everything's important, but there are certain points that I consider key. First of all, even though this is a demo arm, or even when you do it for real, remember that there's a person attached to that arm. So in doing so, please keep in mind whatever bedside manner you've learned and compassion, because that person will need that during that time, because most of these patients will be very sick, or in some cases their first time going to the hospital or the doctor's office. Secondly, when you walk in, correctly greet the patient, but correctly identify the person, because that's the key point that will make or break a good phlebotomy procedure. If you have the wrong patient, then no matter how good the procedure goes, it's going to be a bad phlebotomy procedure, because it's going to be erroneous results. So let's begin. Okay, first you walk in and you greet the patient. You say, "Good morning, afternoon, or evening, sir, madam. I'm here from the laboratory. I'm here to draw your blood." If you're in a hospital setting, if you're in a doctor's office, again, you would give a similar greeting, but just to help the patient feel at ease and let them know what you're going to do. At that point, then when you go to draw their blood, again, make sure you know that this is the correct person. In making sure of doing that, you either check their armband if they have one, or ask them, "What is your name?" Never ask them, "Are you Mr. or Mrs. Smith or John Doe," or etc. Don't prompt a person to make a mistake. After you get the correct information, then you proceed to do the phlebotomy procedure. And we'll do it as follows. First, you don gloves, and this is also very important, especially for someone who's new in the phlebotomy profession, because most people, once they get used to drawing blood without gloves, they find gloves to be a hindrance. So get used to doing everything with gloves, so you'll be virtually not even a factor when it comes to drawing blood. Try to make sure that they're comfortable. As in the case of these gloves, are more of a secure fit, so try to get them one size bigger if need be. But make sure they're comfortable where you can still feel and do your job. So at this point, you pleasantly greet the patient, you found the person's name, and at this point now you tie the tourniquet. Try not to tie it too tight, but firm enough to actually let the tourniquet do its job, and the purpose of the tourniquet is to visualize the vein. Now at that point, now with the vein is visualized, so you want to pinpoint your site, open the alcohol pad. Once your site is pinpointed, you start at one point and start in concentric circles going from the centermost point outward. And at that point, you allow your specimen or your arm to air dry. And most importantly, you release that tourniquet, because the tourniquet should be on no longer than 2 minutes. That point is actually for two reasons. It's for yourself and the patient. It's for yourself because when you're drawing blood, it gives you time to relax, not be so nervous, and to make sure you do a good job, because you'll be very nervous when you start doing real patients, especially in the beginning. Secondly, it allows the alcohol to air dry and not to allow that tourniquet to be on too long. So once you actually go through that procedure, you can go straight through. Now the alcohol is pretty much dry. Repalpation is really not permitted, especially when you're dealing with blood cultures. A few times you have to draw blood cultures. But if you have to repalpate, then you can just take a little alcohol pad and wipe the tip of the finger that you're going to repalpate with, and then feel, and then go ahead. But at this point now, let's reapply the tourniquet. And insert the needle. At this point, I like to encourage that you do this in front of the patient by gently twisting the needle till it comes off and twisting it on until you can't twist anymore, and then eventually remove that. The reason why I encourage you to do it in front of the patient, because then that way it ensures the patient knows that this is a fresh needle and you didn't just use it on someone else and then come to them. So at this point, I'll demonstrate by securing the arm, angle the vein by gently pulling it towards you, and at this point, you bring the needle down to where it's between a 15 and 30 degree angle, and one trick is you can use your thumb as a guide by placing it gently on your lead thumb and tilting it down on a short angle and then inserting it. Once you feel that give that you want, now that you're in the vein, you can actually continue the procedure and switch arms. Now that your hands are firmly in place, you can continue to change tubes. Remember that you have your 2 fingers and your thumb. This will be the prongs that will help you to secure the tube and draw in blood. So you use your first 2 fingers on the wings of the adapter by pushing and pulling. So you'll be pulling, these 2 fingers will be pulling towards you. This thumb will be pushing the tube away from you. By having that counterbalanced action, that will allow the needle to stay in place. So again, pushing the tube away from you and pulling the adapter towards you, that allows the needle to go in. You have blood flow. And at this point, when you're snapping your fingers, if you can imagine visualizing that, use your thumb and your middle finger to touch each other by grabbing the bottom of the tube and using your index finger to push the tube away. This is much better than if this was here and you danced it out, because then it will dance the needle out of the vein. So again, picture snapping your fingers, grabbing the bottom of the tube, pushing it away. And that's how you not only remove one tube or how you continue to change tubes. And at this point, so I'll do another quick demo. Once you insert it, the blood flows and it gets to a certain point. Half full is usually good for most tubes, except for the blue top, which has to be 3/4 full. Gently remove it. And at that point, when you're finished, first thing you do is remove your tourniquet. And afterwards, have your gauze pad ready. And gently place the gauze over the needle without pressing down or adding pressure. And at this point, gently pull back on the adapter and then press down. And I'm going to remove this needle by throwing it away in the wastebasket. Now, normally in many hospitals or facilities or institutions, this will be close by. Either it will be physically on your drawer station, it will be on the wall, or it will be any place where it's close working where you are. But I intentionally exaggerated it by bringing it out late to demonstrate that after you activate the safety device, you can immediately dispose of it by throwing it away. In some cases, you can even throw it away without activating the safety device, but it's much safer once you remove that needle from the patient's arm and it's no longer considered a threat or weapon to either the patient or to yourself should any kind of error or accident occur, or like the patient fainting or something like that. It's now safe and it can be safely disposed of. Okay, and at that point, you can either apply a Band-Aid or ask them to assist you while they're holding that. You secure a Band-Aid. And at that point, you put a pressure bandage by pulling, securing one end, and pulling to the other side to help encourage closure of the venipuncture. Thank you.